those of us who rely on public transportation to get around, the often daily slowdowns or delays amount to not much more than a nuisance.
It can be very frustrating.
But for someone like Kitty Poole, it's a lot more than that.
I've learned to deal with things over this time.
The 76-year-old is a stroke survivor who relies on public transit or public transit mobility rides to get to a doctor's appointment. And she is constantly getting stuck.
When they ask you what time do you want to be there, you can't say the appointment time because that's not going to happen usually.
It turns out Kitty is not alone in her struggles
and puts people at risk for things like social isolation and loneliness.
Dr. Jason Falvey studies physical rehabilitation at the University of Maryland School of Medicine. Most of his patients are elderly and rely on public transportation to get to their appointments. And lately, he's noticed something.
One 30-minute doctor's appointment could take 5 to 6 hours from start to finish.
So he started studying the impacts of public transit on public health. Dr. Falvey found that most older Americans typically walk 5 to 6 blocks to a bus or subway station. Sometimes that walk can be upwards of a mile, which can be scary in a myriad of ways.
And even the risk of violent crime. Many of older adults have told me that they've feared, gun violence or being mugged because they've had to walk with a walker or a cane and been an easy target for somebody while they're walking in their neighborhood.
Unreliable transit systems are one issue keeping people from routine health care, but so are the countless miles of crumbling American sidewalks, creating dangerous trip hazards.
They stick their cane in a hole in the sidewalk unexpectedly. They're at very high risk for, a stumble or a fall. And even that happens just once, and it creates a fear that people just typically stop going out as much.
When 3 million older Americans rely on public transit to get around, just one fall or bad experience can create a ripple effect.
We're concerned that there's probably a lot of gaps in care that are disproportionately affecting people who rely on public transportation.
Dr. Falvey is hoping this new research leads to one thing:
advocating at the state and federal level for increasing funding in public transportation, making it more age-friendly. I think we haven't really centered the needs of older adults in public transit infrastructure.
If it was just really good surface, it wouldn't be a problem. But having to deal with the sidewalks and everything, that's what makes it tougher.
As for Kitty Poole, she is continuing to get around as best she can, knowing her health depends on it. In Baltimore, Maryland, I'm Chris Conti.